Hello, today we will be talking about pregnancy losses. In fact, about 15% of known pregnancies end in loss. Although this rate may seem quite high, if there are 3 or more pregnancy losses, we call this recurrent pregnancy loss. The rate of these is much lower. It drops to as low as 1 or 2%. There can be many different reasons for pregnancy losses. When we encounter a pregnancy loss, unfortunately, we are not able to fully determine the cause in more than half of these cases. Among the cases where we can identify the cause, genetic factors are the most common ones we see. In other words, abnormalities related to the baby's chromosomes. Sometimes we say things like, maybe it's for the best, because we think that it protects us from situations related to the baby or the mother that could become much more dangerous, much more negative, and medically much more challenging for us and the family in the future, when it happens at very early weeks. Apart from that, there can be some congenital abnormalities related to the uterus or ovaries, structures like fibroids or polyps inside the uterus that can prevent the baby from implanting, or other anomalies. Certain infectious diseases, microbial illnesses, can sometimes cause pregnancy loss. And one of the most complex reasons is what we call immunological, which is related to the mother. For example, clotting disorders, or again, sometimes issues related to the mother, where we can easily identify the cause, but sometimes it really takes a very long time to find the reason. In some cases, there can be different situations related to how the mother's body accepts the baby. The most important thing in these pregnancy losses is to be able to determine the cause, especially in cases of recurrent pregnancy loss. Clinically, we don't get too worried if there has only been a single pregnancy loss. However, even though by definition we consider it recurrent pregnancy loss after 3 pregnancies, nowadays our general approach is that if there is a second loss, we start more detailed investigations. Before a 3rd pregnancy occurs, we want to use all the methods at our disposal to help the family and the expectant mother. And if we have a chance to prevent the loss of the next pregnancy, of course, we want to make use of that opportunity to the fullest. By the way, I'd like to end on a positive note. Generally speaking, for families who experience recurrent pregnancy loss, we know that there is more than a 60% chance of having a healthy baby in the future.